Hi everyone, today we'll be talking about the cranial nerve 3 as well as some of the important questions to answer in a short case exam. Patients usually present with diplopia and we'll look for features to support that this is a CN3 lesion. In terms of ptosis, we want to know whether this is a complete or a partial ptosis or whether it is a unilateral or bilateral involvement. In complete ptosis, it is more suggestive of a medical cause. On the other hand, if the ptosis is bilateral, it is more suggestive of a nuclear lesion rather than a fascicular lesion in the brainstem. In terms of pupils, we want to know if it is dilated. A fixed and dilated pupil is more suggestive of a surgical cause. In the case when the patient sees double, we will then do the cover test. For example, if the outermost image disappears on covering of the left eye is the affected eye. On general inspection of the patient with cranial nerve 3 palsy, the affected eye is usually down and out in position. Hence, we would like to stress the maximal diplopia by asking the patient to look up and out to see if in this position the images are further apart. We would like to move on to look for the involvement of the other cranial nerves, particularly cranial nerve 4 and 6. So in terms of cranial nerve 4, we would like to ask the patient to abduct and as well as adduct the eye to look for intorsion as well as ability to depress the eye. We will also look for the function of the cranial nerve 6 as well. Moving on, we will then localize where the lesion in the midbrain is. We can read up about the nuclear lesion as well as the fascicular lesions. In fascicular lesions, there are several syndromes that are present, one of which is the Weber syndrome, where besides the ipsilateral CN3 lesion, you will also have the contralateral hemiplegia. There are also many other syndromes that you can read up about. Outside the midbrain, there are various causes of a cranial nerve 3 lesion as well, such as herniation, PCA aneurysm, as well as the cranial nerve clubs that involves cavernous sinus as well as the superior orbital fissures. There are also other peripheral causes, and I've divided them according to the vitamin ABC format. You can also come up with your own mnemonic for it. Lastly, to end off, I have summarized some of the differences between the medical as well as the surgical third here in this slide. We really hope that you enjoyed the video and do leave us with comments below to let us know if there are any topics that you would like us to cover. Thank you.